Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Dr. Fiona Shehaj, Chief of Women's Cardiovascular Health at Richmond University Medical Center. Thank you so much for joining us today.
Thank you so much for having me. It's a pleasure.
Of course. So through RUMC Connections, you will meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide you information about your own health, explore the latest medical trends, and hopefully get you answers to some of your own health-related questions. Heart disease is the leading cause of death nationally. We have high blood pressure and cholesterol as two of the primary causes of heart disease, and approximately 27% of Staten Island adults have high blood pressure and/or high cholesterol, a slightly lower proportion than the nation overall. But despite this finding, Staten Island has historically had a higher rate of death due to heart disease. So in this episode, the wonderful Dr. Shehaj returns, and we will delve into how the healthcare system has historically overlooked women's cardiovascular health and the importance of gender-specific research and treatment. So we will highlight your fantastic work today. We will check out some of the challenges in the field and your vision for the future of women's heart health. So thank you so much for returning and joining us again.
Thank you for having me.
So let's jump right into it. Women's cardiovascular health has historically been underrepresented in research. Why do you think this disparity exists?
Absolutely. So as we said in previous episode, we are definitely underrepresented, not only in research when it comes to female patients, but also in the women scientists that are included in the studies. We are underrepresented in women physicians as well. So definitely there's a disparity amongst all populations from the research, from the providers, from medical journals as well. So we definitely need to do better when it comes to representing women and having this representation, which could potentially save lives.
Are you seeing a change now, present day? Like, are you seeing more women cardiologists or more studies, fortunately, hopefully, being done?
We are, but unfortunately, it's a very snail pace for sure. When I started medical school, absolutely. When I started medical school, I would say only about 10% of women of cardiologists were women. And then the past decade or so, we're seeing an uptick of about 15%. So definitely where we're not like where we like things to go and to see, but definitely we're seeing a little bit of an incline there. And I try my best to, when I have students, when I have residents and fellows, to definitely kind of steer them in these subspecialties that are disproportionately more men than women.
Yeah, definitely needed.
Mm-hmm.
So now what motivated you to focus your career on advancing heart health for women?
Sure. So I would say that heart disease in general, it's the number one killer in this country. So definitely that led me into this arena. But then I was seeing more and more while I was training that women, unfortunately, were not being listened to when it comes to our symptoms. We were very much kind of pushed off to the side, or our symptoms were not taken care of very easily, or being paid attention to. So when when a man presents with chest pain, immediately we jump to the conclusion that this might be heart disease. So we do the EKGs, we do the blood tests in order to rule out a heart attack, for example, when they come into the ER. But women, not so. When even to this day, we're seeing that women are, they're being diagnosed with acid reflux instead of being looked into in the light of heart disease. So definitely, we need to do better when it comes to paying attention to women's symptoms.
Can you share maybe some of the most common myths or misconceptions about heart disease in women?
Sure. So basically, as we mentioned previously, heart disease was seen as more of a man's disease. Mm-hmm. So when a woman presents with certain risk factors, with certain symptoms, we're not necessarily thinking of right away that could be heart disease.
Yeah.
And then also women, even to this day, our risk factors are not taken care of as aggressively as a man's risk factor. Mm-hmm. We're seeing that women definitely our cholesterol levels are not being aggressively treated as a man's would be, or diabetes or high blood pressure, and our screenings are not as up to date as a man's would be. We definitely need to do better when it comes to how we view women's risk factors, and we need to recognize that women are just as much afflicted with heart disease as a man would be.
Okay. How would you say that this exclusion from clinical trials in the past has impacted the medications and treatments that are available today, especially for women?
Absolutely. So we're trailing behind when it comes to research groups. Men have the upper hand here. They've been studied and treated and have
Hmm.
all these medical studies they've done for decades and is over 100 years now. Whereas women, we're just starting now to be included in studies. And
Hmm.
as I mentioned in the previous episode, it wasn't until 1993 when Congress passed a law mandating that women are included in studies that we started to be included in
Hmm.
these studies. And still, we're lacking when it comes to women being included in preventative studies, in medication studies, in treatment studies. So we're still lacking in that arena as well. So we definitely need to do better. We definitely need to advocate for more women to be included in the studies because our physiology is not the same as a man's would be.
Yeah.
So we need to start to be aware of what these differences could be and what they could translate in how we treat our patients.
So, because our physiologies are different, would you say that the medications that are currently available are, really more tailored for men? Would they be less effective for women, or do you think like women just really need a whole different medication overall to better treat?
I think it's a little bit of both.
Okay.
Definitely, we need to do more studies in order to see if physiology plays a huge part. But we know for a fact that certain ethnic groups react to medications differently. They get certain benefits more from certain medication that they do from others. So we need to also study whether this is also true for women, specifically gender. So definitely we need to have more of those studies. But we definitely see that women. Um, if we're taking certain medications or certain hormonal replacement therapies, that we need to see the interaction with other medications if they're as beneficial and as effective in women as they are in men.
Okay. Yeah, that would be interesting to see.
Mhm.
What impact has this had, on how we diagnose and treat heart disease in women?
Sure. So the screening studies, for example, again, going back to underrepresentation, we might not be as willing to test women because we keep thinking that men are going to be the ones that are being afflicted more.
Hmm.
So we see providers offer these certain screening tests more in men as opposed to women, and treating women not as effectively and not as aggressively as they do in men, thinking that, oh, maybe they're not going to get heart disease as easily
Yeah.
as a man would.
Okay.
So we definitely need to pay a bit more attention to these nuances and treat women just as seriously as we do men.
Yeah. How have societal and cultural attitudes contributed to the neglect of women's cardiovascular health?
Sure. So women in general, we're not as taken as seriously as men are when it comes to screening. But within that, also women of color are disproportionately not as treated as well or as aggressively as other groups of women are as well. So definitely something that we need to pay a little closer attention to.
Okay. And, are there examples of gender bias in treatment that still persist in modern medicine?
Absolutely. Again, women are not as aggressively treated when it comes to cholesterol or diabetes or high blood pressure. We keep thinking that maybe women there's other things that would affect women a little bit more. For example, like breast cancer
Hmm.
or other medical therapies. We keep thinking that maybe women should not be treated as aggressively because of pregnancy or because of menopause, and that couldn't be any further from the truth. We need to take women's risk factors under serious consideration and treat women just as effectively as men would be.
Okay. How do hormonal changes like pregnancy or menopause, impact a woman's risk? Are
Sure.
they more at risk during that time period or?
Definitely.
Yeah.
So women during pregnancy were higher chances of getting things like high blood pressure during pregnancy and preeclampsia and gestation diabetes. And these are issues that affect us not only during the pregnancy time, but they carry the risk factors thereafter in older age as well. And then during menopause, we have a precipitous drop of estrogen levels, and estrogen has been shown and proven by studies that it is cardioprotective. Estrogen reduces inflammation in our coronary arteries, so when we enter menopause, this protection goes away and places us at a higher chance for heart disease thereafter.
Hmm. Can you take an estrogen medication to try to protect the heart after menopause?
I wish it was as simple as that. Unfortunately, we're not seeing a very strong correlation to that. But definitely, I think estrogen and other hormonal replacement therapies are better tailored to a specific case-by-case basis. But I wish there was a magic pill
Yeah.
or something like that that would take
To
and take care of
continue.
this, for sure.
Okay. What are some warning signs, women should monitor for during pregnancy that might indicate cardiovascular disease? Because I know some women, never even learn that they have an issue until they become pregnant and they start, developing these symptoms, and it's like a big surprise because they never had any indication of it.
Absolutely. So, in preparing for our talks, I saw a very staggering statistic that 9 out of 10 women has some sort of risk factor for heart disease, whether that's obesity, whether that's a history of smoking, high blood pressure, even prediabetes or having insulin resistance can also increase our chances for heart disease. So, 9 out of 10 women having this sort of underlying risk factor that's festering and placing us at a higher disadvantage is it's a very unfortunate statistic.
Hmm.
And then women entering pregnancy, because there's a stigma that a young woman is a healthy woman, so they might not need the screening tests and the certain things that we offer other population groups. We go into pregnancy. Only 50% of us go into pregnancy are aware of our risk factors. So that puts us at a disadvantage and also increases our chances for preeclampsia and gestation diabetes and high blood pressure during pregnancy. So it's a very vicious cycle that we're going into these very stressful situations in our bodies, not knowing where we stand with our health care,
Hmm.
with our health.
Oh, for sure. And, how should women approach post-pregnancy follow-ups if they experienced conditions like, preeclampsia or the gestational diabetes?
Again, pregnancy is not the end all. You need to continue to follow up with your providers, with your cardiologist to see what your risk factors are moving forward and continue to keep a close eye on those risk factors. Because as I mentioned, these are not just things that end with the pregnancy and after delivery. These are things that you can carry on beyond that. It's very, very important to have your annual checkups, at
Hmm.
least annual checkups, to know where you stand with your with your blood pressure, to know where you stand with your cholesterol and with your A1C and daily glucose. So it's very important that you recognize your issues do not end after pregnancy; that they
Hmm.
can continue on, and it's very important that you continue to see your medical providers in order to decrease your risk factors for heart disease moving forward.
So, in terms of genetic risk factors, I know when it comes to certain diseases, sometimes people are more predisposed if it's on their mother's side or their father's side. Have you seen any evidence of this in women that if it runs in a certain parent's family history, that they're more predisposed to it?
I wouldn't say that they're more predisposed. I think genetics plays a minor but very important role when it comes to heart disease. I would say maybe about 20%
Hmm.
of heart disease is due to genetics. So that's a good sign as well, because that means that the other risk factors are potentially curable, treatable, or even preventable. But genetics, I would say overall, it afflicts people across the board.
Okay. And are there any, new studies or treatments being developed to address the impact of menopause on heart health?
I think that's still an ongoing area of study. Hormone replacement therapy. We were hopeful that would be a huge treatment thing for women, but unfortunately, it's not
It's
as
not.
easy. It's not as simple. I would say more risk factor modification when it comes to lifestyle would definitely be a little bit easier to deal with and a little bit sooner to deal with.
Hmm. Okay. Now, stress is often a silent
Yes.
factor of heart health. Why does stress disproportionately affect women's hearts?
Yeah. So stress is definitely something that unfortunately afflicts a lot of us.
Yeah.
Women tend to make up more of when it comes to single parent household, women tend to make up more of that population group. So women are just stressed out. Women are going to work. Women are then coming home and taking care of their families, of their children. So women are less likely to take care of themselves when it comes to their risk factors and when it comes to their symptoms. We're not making time for ourselves in order to visit our medical professionals and get taken care of. So, and then also, women's heart generally are smaller. That's just the physiology of it. So that means that women have smaller arteries, making the coronary artery disease a bit more serious in women, because now we have less surface area in the lumen of our coronary arteries to deal with plaque buildup as well. So making it much easier for women to build up plaque and have a heart attack as well.
And how would stress impact that?
So any stressors, whether that's mental, whether that's physical, whether that's dealing with with racism. So it's a lot of issues that affect women, and women are stressed out. And it seems almost taboo when a woman speaks up and says, I'm not feeling well, or I cannot handle this task, for example. So we feel the need to overcompensate by working longer hours or taking care of the household because they feel that's their traditional role as well. So essentially, we don't just go to work and then come home to our families. It's almost working 2, 3 jobs sometimes, handling all these tasks at once, and it's very, very difficult.
It sure is.
Yeah.
Okay. So, can you maybe discuss the connection between mental health and cardiovascular health for women?
So mental health in general, I would say is it's almost like a gatekeeper to your health.
Yeah.
So if you're not feeling well, if you're feeling anxious or depressed, you're less likely to take care of yourself. You're less likely to take your medications, to see your provider, to go out there and have hobbies and meet people. So definitely, mental health is a huge area where it can hinder us from getting healthy and getting the help that we need.
hmm And what, like, with all of this stress, what direct physical impact would it have on the heart?
So stress itself can increase your blood pressure, can increase your stress level, stress hormones, which can increase your insulin resistance, which can increase your inflammation in your body, which can make it easier for plaque buildup to happen. So definitely stress is not just a fleeting moment of not feeling well or feeling anxious. Stress and consistent and chronic stress can definitely impact your health in very negative ways.
Takes a toll on the
Absolutely.
heart, of course. Okay. So what progress has been made in understanding and addressing, women's cardiovascular health in these last couple of years? Is there anything that you've really been, happy with or, anticipating, a good direction?
Sure, sure. So I've seen the more we talk about women's issues,
Yeah.
women's cardiovascular health, the more we see women coming into the offices and saying, "I heard about this new test. Is it
Great.
something that's good for me? Is it something that I am a candidate for?" So I love this conversation that we're having here today because it puts women, it makes women aware that they too are as at risk as a man would be for certain risk factors, for certain health issues. And I think community outreach is definitely a very important role as well because we're advocating for women more and more nowadays. So there's a lot of work to be done, but definitely something that I'm seeing positive changes in.
Great. How can the healthcare system, better support women in underserved communities who may lack access to cardiovascular care?
You mentioned it. Access is definitely a problem in this country when it
Yeah.
comes to healthcare. We're seeing across the board people are not, they do not have the healthcare that they need. And it's expensive for a lot of families to have healthcare. So it's the difference of putting food on the table versus going to get a checkup, for example. So we need to make it more easily accessible for people to have good healthcare. It's still an ongoing issue, and I'm not sure when it will be resolved or how easily it can be resolved. But I'm hoping that definitely will, with having these conversations, that we're making it a bit more easily aware for people to know that they have issues, and hopefully our government will also listen in the process as
Mhm.
well. That we need to have these methods to reach more people and reach more women, especially.
Of course. And that's why, I think you and your fellow cardiologists at RUMC, it's wonderful what you do with all of the community outreach events. And we're penetrating into all of those communities to offer, screenings to people who may not have, any health insurance or, the access to the knowledge, or a screening.
Absolutely.
So it's a wonderful thing that you're all doing.
That's true, and you said it. I think education is definitely a big thing, and
Yeah.
teaching patients and teaching women in particular what their risk factors are and how they can change these risk factors, or just educating them on diet and lifestyle can be as
Yeah.
simple as making a big impact in their
hmm
lives.
Sure. Are there any, particular healthcare policies or programs that you think could make a big difference for women's heart health?
I think just reaching them more when it comes to accessibility to healthcare,
Okay.
and that's definitely an arena where I would love to see some progress in. Just
hmm
having more healthcare, having more low cost options, having more education, and having more telehealth even to in order to reach more women would be very beneficial.
Yeah. And how could the medical community as a whole, better educate women about their unique risks and symptoms?
I think it starts with getting educated yourself. So essentially, just being more prepared to see women and to see this evolving community of risks, and to see what afflicts women on a day to day, and just being more in tune with women's needs, and listening to women especially. So education starts even with the provider.
Absolutely. Okay. How can women, use education and outreach programs, to break barriers, for women's health?
Sure. I think just being your own self advocate. So taking the information that's out there and applying it to yourself, and being your self advocate. So when you go to the doctor's office and let's say you tell them what your issues are,
Hmm.
if you're not being listened to, there's other doctors out there, other providers out there. So go to someone that will listen to your needs.
Absolutely.
So definitely being self educated yourself, being your own self advocate will definitely help in mitigating those risk factors.
Yeah. Are there any support groups, or community networks that you could recommend, to improve awareness and action around heart health?
So I don't specifically say that there's one certain resource. I would say it starts with even having discussion with a friend and seeing who they're seeing for certain health needs, speaking to your religious institutions, speaking to your community groups. I know,
Hmm.
for example, we take part in the JCC and the
Yeah.
YMCA, so we go to these places in order to screen patients for heart
Hmm.
disease as well. So just being aware of what's out there in the community can be the first step to get introduced to what's out there.
Yes. Okay. And what questions should women ask their doctors during checkups to ensure that they're being properly screened for heart disease?
Yes. So I've noticed that a lot of women we're not aware of what good blood pressure is. We're
Mm.
not aware of what a good cholesterol level is, or at what age their risk factors for heart disease get worse. So it's very beneficial to have these conversations with your medical provider. You don't just go to the doctor's office to get a medication and then leave the office. You need to leave there understanding as to what your risk factors are and why it is so. So it's definitely beneficial. Let's say you get your blood pressure taken, have a conversation with your doctor. Is this a good number? What can I do to make the number better? What can I do to reduce my risk factors moving forward? Is my diet okay? Should I be following a certain lifestyle change or a certain dietary change? So basically, being a bit more active and a bit more proactive in these visits in order to have that relationship. It shouldn't be just one way where you get the screening from the doctor or the medication from the
Hmm.
doctor. You have to leave there knowing why you're getting that certain advice or that certain medication.
Yeah. Can you possibly share, a success story of a patient or a program that made a significant difference in addressing women's heart health?
Yes. So I noticed that even since we started to have these programs and these discussions, that I'm seeing more and more women. They're listening to these podcasts and they're listening to these discussions and coming to the office saying, "I think I need to get screened for such and such thing. I
Great.
didn't think that it was a big deal, but
Hmm.
now I understand that this is something that can increase my risk factors for a heart attack, for a stroke moving forward." So I'm so happy that we're having these discussions and spreading awareness and spreading this sort of information because it's making it easier for people to have these
Yes.
discussions.
Hmm. Very, yeah, informal way for people to really, learn a lot and take it in at their own
Sure.
pace and ask questions.
Absolutely,
Yes.
absolutely. And in fact, I had a patient a couple of years ago. She was seen by another cardiologist. This was in Brooklyn, and she had all the testing done. Everything was fine. She had a stress test. It was normal.
Okay.
So that essentially, in her head, ruled out the chance for her having a heart attack.
Yeah.
Shortly thereafter, a few months after, she started to have this feeling of palpitations, or what we call an elevated heart rate and feeling of anxiousness.
Hmm.
So then she came to see me thereafter. She happened to be visiting her daughter. Her daughter brought her in during the appointment, and she mentioned to me, I've been feeling this sort of way. We made her an appointment, and sure enough, after an additional testing, I saw that she had actually a significant amount of plaque buildup in her coronaries, and she ended up having two stents placed thereafter.
Wow.
So if she was to just rest on the fact that she had a normal stress test 6 months ago, maybe she would have had a heart attack
Yeah.
or death or heart failure thereafter. So
Wow.
it's definitely a good idea to self-advocate and to mention these sort of symptoms despite you having a normal set of blood tests or a normal set of tests
Hmm.
a few months ago.
Okay. And how are you able to check when you're looking for the plaque in the arteries? Some women might not be aware of what type of test that is.
Sure. So we have a few different ways of assessing if someone has ischemic or blockages, heart disease in the coronaries. Stress testing is definitely a great way, but now we have more imaging modalities as well. CT calcium scoring, CAT scans that score how much plaque buildup has been building up in our coronaries up until this point in life. And then also CT angiograms, which is basically, in addition to having the calcium score, it looks to see how much plaque buildup has happened, where the plaque buildup is located, and that's very, very simple. It's a non-invasive, fairly non-invasive. You get an IV line placed. You get an injection of a nuclear material. Very, very similar to other CAT scans that people may have had. It's very common testing so far. You get placed in the machine. You get rolled in. Few minutes of having images taken, you get rolled out, and you get a report that you can discuss with your physician to see what the information means, how we can lower the risk for a blockage moving forward, and what changes you can make in order to prevent a huge event.
Wow. Okay. And there might be some people out there who don't even know what a stress test is. So can you maybe explain what is done for that?
Absolutely. So stress tests, there's different modalities to stress testing. And I know patients, for example, whenever I do bring that up, the first thing they tell me, oh, I can't walk on the treadmill. But a treadmill or physical activity during a stress test is not the only modality that we use in order to quote unquote, stress the heart to see if there's a blockage. Of course, the traditional route is just as simple. Have the EKG leads placed on your chest, and then you get put on either an exercise bike or treadmill to see if there's changes from the baseline to signify a risk for heart attack or for blockages. Now we can do that with medications. We can do that with imaging, for example. So it's different ways the stress testing can be done.
Yeah. And I think, when a lot of people think about cardiovascular health, they think that they have to just do cardiovascular activities. But on top of, maybe running, walking, swimming, things that are typical, cardio exercises, how important is strength training for women?
Very important. So strength, I would say that cardiovascular exercise is good for cardiovascular health. It keeps us happy. It keeps our heart more efficient. It keeps our lungs moving, breathing better as well. But strength training is where the money is, because strength training increases our muscle mass.
Yep.
It also predisposes us to better bone health as well. And muscles, we are able to break down more fats and have a lower body weight with strength training as well, which translates into how our bodies process sugars and how our bodies process fats. So strength training is definitely a huge thing that we need to be more aware of, and something that we need to also incorporate into our daily activities.
Of course. And how many, days a week would you recommend women to strength train?
I would say a mixture is a good way to go. So I would say a good way is maybe 3 days a week of strength training and 2 days a week of cardiovascular exercises. But again, any exercise is good exercise. So I would say do not strive for a certain number. If all you can do is a few minutes a day, that's good enough for me. That's better than nothing.
Of course. So if you could change one thing about how women's cardiovascular health is addressed, what would it be?
I would say paying more attention to women's symptoms, because they're not as traditional as a man's would be. Maybe sometimes all that the woman will present with is a headache or maybe a fainting episode. So these are things that should be a red flag and a doorway into us doing a bit more digging into what's going on. So definitely paying more attention to women's nuances and these vague symptoms that women present with.
And what inspires you most about the progress being made in women's cardiovascular care?
That I'm seeing that definitely there is progress, but there's a lot more progress to be made. So I'm not giving up. I did not come into this to the specialty to just give up now. I think we have a whole lot of work to do ahead of us, and I will not give up on that. So definitely, and it's not just myself. Thankfully, other physicians in the community are also big advocates for women's health. So together, I think we can accomplish a lot more.
Okay. And let's, let the audience get to know you a little bit better. What do you like to do outside of the office? How do you decompress? And what's your favorite way to take care of your heart?
Sure. So definitely, I try to follow my own advice. I'm very intentional about the food that I eat and the snacks and the sugars. Of course, life is about balance. So you can have things that you enjoy, but definitely it's being more intentional. I keep a food journal, so I need to know how many calories I'm taking into a day and how much exercise I'm getting into my body. And I'm definitely trying to keep up with that a bit more. Yeah. And also, I think hobbies is a big thing. So doing things that you enjoy, maybe on the weekends or certain nights of the week. Mental health is very important. Speaking to a mental health professional and having a therapist that you can unload and have good coping mechanisms. So it's a lot of different things that can play a huge role and huge impact in one's health.
Yeah, absolutely. Well, thank you so much for joining us today and enlightening us further on women's cardiovascular issues. And I, too, hope that this, progression of research and everything continues and you achieve your goal.
I hope so, too. I hope so.
So thank you once again for all that you do to keep our community safe and well. If anybody else would like to learn about RUMC's cardiology services and come in and see Dr. Shehaj or her team, you can call 718-818-7414 or visit rumcsi.org. Thank you so much again for joining me.
Thank you.
I'm Meredith Gaskins.